Good morning, everyone. My name is Cornelia Stevens. I'm the Executive Director of Top Early Learning Centers here in Wichita, Kansas, and I also have the privilege of being the chair of the Kansas Early Childhood Recommendations Panel. I'd like to thank you guys for taking time out of your busy schedule to spending the morning with us. And for those of you who are watching online, welcome, and we are glad to have you. I'm going to first start out by just going over the agenda for today's meeting. But first, I want to let you know that it is a remote meeting. And so all of the materials are posted on the Kansas Children's Cabinet website, which is kschildrenscabinet.org. Panel members, we ask you to speak clearly and identify yourself when you are speaking, since we do have people that are watching virtually. They may not be able to see all of the names or recognize all of your beautiful faces. We also ask you to use the raise hand feature, although that is not required when you are going to share, just so that I can keep track of who's actually asking to speak. That would actually be really helpful. For our agenda for today, we're going to start by approving the September agenda. We're going to approve the August meeting minutes that Hannah sent out. We're going to see whether or not we have any people who would like to come forth and speak to the panel through the Kansas Open Forum. We're going to have a presentation of the Kansas Child Care System cost model, a budgeting tool, an update on the workforce appreciation bonus, the career pathway, any bright spots that you all have that you would like to share, go over the dates of our upcoming meetings, and then our meeting will end. So we actually have a pretty full agenda with lots of updates of things that we've talked about in the past and or some new items that we haven't talked about before. And so I thought it would be good to just bring back and let's see where progress we've made in the state of Kansas. So the first thing that we're going to do is we are going to approve the agenda that was sent. I'd like to let you know that there's going to be one modification to the agenda that was sent out. On item 5 on the agenda, it says that we are going to be reviewing the child care cost estimator presentation. It is actually the child care systems cost model. And so that name is going to be changed. And then as opposed to it being the Kansas University Center, it is the University of Kansas Center for Public Partnerships. And so those two changes will be made to the agenda. So if there are no other changes, may I have a motion to approve the agenda?
This is Natalie McLean. I'll make a motion to approve the agenda.
Perfect. May I have a second?
This is Pam Noble. I'll second.
All right. All right. September agenda is approved as amended. The August minutes were sent out by Hannah. Does anybody have any changes to the minutes? I see no changes, so may I have a recommendation to approve the minutes as provided?
This is Donna Chestnut. I'll move to approve the minutes.
Perfect. May I have a second?
This is Amy Meek, and I'll second.
Thank you.
Do you want to put it to a vote?
Oh, I'm sorry. Yeah, that would probably be good. So all those in favor say aye.
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 Perfect. And or thumbs up. That's great. Anyone opposed? Same size. Same sign. No opposition. Perfect. Thank you for that, Ms. Hannah. So do we have anybody slated on the Kansas Open Forum for today?
No, ma'am, nothing was received.
Okay, perfect. And so anybody who is watching virtually, please know, if you're watching online, if you have any comments or things that you would like to share with the committee, you are encouraged to email your request to Hannah McGahey at hmcgahey@ksde.org by 5 o'clock. And so we do encourage anybody that has any information that they would like to share with the panel. And so, so please don't hesitate to do so. So for our first presentation, we are going to have an overview of the Kansas Child Care System Cost Model Update. This presentation is going to be given to us by the University of Kansas Center for Public Partnership and Research by Ms. Jenny Welch Buller.
Thank you so much for the opportunity to share a quick update and the invitation. It was great timing. We've just recently started dusting off the model and putting it to work, so I'm excited to share the update. So just a quick refresher, my name is Jenny Welch-Buller. Actually, if you could go back real quick, I want to unveil all the exciting stuff. Yeah. I am a research project manager at the Center for Public Partnerships and Research, as you mentioned, but some of you may, just to kind of connect some of the dots, some of you may recognize me from serving on the panel last year and some of the work I've done supporting the state. And it's good to see you all again, and reach out anytime with any questions. So before I get into updates, I thought it'd be helpful to start with a bit of background, especially for our newer members, just kind of setting the stage on what is this cost model and why are we using it. So last year, Simon Workman, a national expert on early childhood fiscal strategies, developed a cost modeling tool embedded with Kansas-specific data. The model was inspired by, in part, by his work with the Office of Child Care and other states to look into addressing the unique challenges that the childcare market presents, setting subsidy rates and improving compensation. So we thought it was a great opportunity to develop our own specific Kansas version that's available at the national level. In May, some of you may recall, we invited Simon Workman to come talk to a few work groups about cost modeling, what we could do with it, and what the true cost of care really means and why it's important to investigate that at the state level. So since then, as we alluded to, we've made some timely updates, plugged in some newer data, and are just putting it back to work. And that is where you all come in. So next slide. Thanks, Hannah. So again, just before I get into detailed updates, I just wanted to share a bit on the what, the why, and the how, just to center us all around, again, what this tool is. Basically, the childcare system cost model is an Excel tool that's programmed with Kansas-specific data and a few primary ingredients. I like to think of a lot of things in baking terms. We've got revenue in there, we've got cost data in there, capacity data, and population data. And we can turn some of those on and off, and I'll get into that here in just a second. But overall, basically, we can use this tool to explore and try to better understand the gaps between revenue and costs. We know they're there. We don't necessarily need a model to tell us that there's these challenges in the childcare market between what parents can afford and the price of care versus what it costs to actually provide care. But the model can help us get a little bit better, I think, at talking about that. And I think that's one of the benefits I think we discussed back in May. It was a really rich discussion. The tool can also set us up and allow us to stress test. I'm borrowing that phrase from our conversation in May as well, to stress test and estimate possible systems level solutions for increasing compensation and benefits. And that's really at the heart of it. That's why we developed this, is to take our ideas, take the research out there, plug it in, see what would it cost, and continue those conversations. So we do this. How do we do this? We do this by setting conditions we want. So again, we have all those ingredients. We know a little bit about Kansas based on a bunch of different public data sources and valuable reports. So we plug all those conditions in, and then we can tweak or adapt a few data points and run some calculations. And in the next slides, the next two slides, I'd love to go down some of what those data points are, what the ingredients are a little bit more specifically, so you can start to imagine what types of scenarios we can run. Next slide. Thank you. So this is a list of some what we call, or what Simon taught me to call, key cost drivers. So as you can see, and as I'm sure you're very aware, wages or personnel expenses are the key cost driver, and a lot of childcare programs operate on very tight margins, with, again, staffing being a primary expense. So that's why I wanted to highlight these to start out. So these are, again, to help you imagine a little bit about what we might be able to tweak to run a scenario on different compensation scenarios for Kansas. So I wanted to talk a little bit, hone in a little bit on wages, because that is one of the features. We have some model, the model has some few options already embedded in there. One is the market rate survey. This is wage data from the 2020 market rate survey and narrow cost analysis that DCF oversees and funds every 3 years to inform subsidy rate setting. These reports are really valuable tools to help us understand a little bit of the current landscape that's driven by the market. So we plug some of that data in as one of our options, and we can use that to, again, try to get a picture of what are current conditions. Then we can run some other scenarios. There's kindergarten parity data in there, for instance, and Bureau of Labor Statistics data that allows us to take a look at other wage scale options and experiment essentially with what that would cost if we were to tweak those compensation elements in the system. I think most interesting perhaps to you all would be the ability to plug in our own baseline wage scale, just to again explore what would it mean to go from current conditions to a different future scenario. And so that is something we can plug in and look at as well. So, all right. Next slide, please. All right. So again, I know this is a lot of words and it may be overwhelming. I'll try to sum it up in the end, but I wanted to, again, just give you a peek into some of the details within these spreadsheets that we can tweak and when running scenarios. So we can use the recent publicly available data on the percent of children needing care from our census data, for instance, to then look at broad scenarios on like, what if we were able to close the gap? What would that cost? We can adjust the capacity. We have capacity data embedded in there, subsidy data, and again, the wages and benefits, and we can adjust all those to set the conditions for our scenarios using our understanding of what our current state is, some averages and medians. We can set a scenario, the conditions, and then tweak one or more items on this list to see what the impact would be. So I would invite you to keep these in mind if you can. Just kind of, you can summarize it in your mind as population, benefits, wages, enrollment percentages. So just think expenses and revenue as we head to the next slide. So here, finally, the update, what I came here for, and thank you for your patience as I went through and recapped what the model can do and what it is. Here's what we have going on and what we've been doing since May and what's next. So since May, we've been updating with more recent Kansas-specific data where available, just to make it as fresh and relevant as possible to the current times. And we've been training new staff to support using this tool in our work ahead. And we've also been researching, and I think this is a key element, before we even get into the model and start running scenarios, it's important to research what's been done out there already on compensation and what are wage models that we might want to plug in to test out. So we've been researching and comparing different methodologies from basic needs to living wage and trying to grasp, but have a better understanding of what that means for Kansas. So our next steps then are to start running estimates on the current conditions and then to stress test possible future scenarios. The what ifs, the what if XYZ, what could we change? What would that really mean at the end of the day? So with that in mind, this is the exciting part. We would love and appreciate this opportunity to really get your input on what we might consider or explore as we develop some of these scenarios. And again, if we need more time to sit with this, or if you'd like me to come back and kind of walk through some of the details again in work groups, I'd be happy to. But also, I know if we have time, Hannah, I might have taken up all my time, but if we do have time, I'd be happy to answer questions and then also get your input if you have ideas already on what you'd like us to consider.
No, you're absolutely good on time. And I actually have not seen our next presenter come into the room. So
Okay,
you're
great.
okay. Yeah.
Okay, well, yeah, in that case, I am here for questions and also would love to hear your suggestions. And I see we have a hand raised.
Nikki.
Yeah, so this is Michelle Adams from DCF, and Jenny knows this, but
Yes.
I do want to share at DCF, we have asked Simon Workman to use this cost model to help us with a new narrow cost analysis to be completed to look more closely at our subsidy rates and whether those rates truly, because the subsidy rates were based on the market rate survey, to determine if with the cost model, if the subsidy rates are high enough for our childcare providers to meet the basic health and safety requirements. And then they also looked at different higher levels of quality. So the first 4 links and links to quality. And they also looked at our Kansas Early Head Start childcare partnership model and how much that costs to operate. And so we've received back from him the updated narrow cost analysis. It hasn't been made public yet because we're still working with the Office of Child Care. We have to update our state plan, and then we have to look at what the information means and what changes we might make to our subsidy system to take that information into account. So I just wanted to share that subsidy related work that's going on right now.
Thank you. That is critical. I know I didn't talk much about subsidy, but that is a key part of what you can plug in. And I think that's very exciting, really exciting work. And thank you for sharing that. Hannah, I'm afraid I did not see who's next. Do you mind?
I think Emily.
Hi, Emily. Oh,
Hands up
I think
before
you're muted. There you go.
I think Lisa had her hand up before I did, and I'm happy to defer to her first. Lisa, do you want to go or you cool?
Sure, I'll go. It's Lisa Schmidt, and I'm the director of the Women's Community Right. I apologize, excuse me. I apologize for asking this question, but is this model available yet for someone like the Y that runs a child development center and we operate on a budget? And as a nonprofit, we ask for funds in the community. And these are important facts and figures when asking for, applying for grants.
Lisa, that is an excellent question. And I completely meant to address that. And it's actually a perfect lead in to our next item. So this tool is more of the systems level estimate tool support to inform policy. And there is a tool that Child Care Aware of Kansas, I know we talked about, I think it was in May, first learned about it, has that's at the program level and I believe available. And so I should probably defer to our next guest on that. But this one is, we aren't able to share it in its form online at this time because it's we have a non-disclosure agreement, which with Simon. But what we can do is work with partners and come to groups like this to run scenarios together, or take the questions you have and plug them in. It's more of like we develop a profile of a child care center and of a family child care unit, and we use those 2 profiles to then estimate what would it cost at the state level to make X, Y, Z changes. But that's a really great question, and it does come up, and I am excited that we have another tool in our state toolkit to hopefully respond to those needs. Thank you.
Perfect.
Emily?
I think next we have Emily.
So my question was going to be similar, mostly kind of coming into like, when did you get to see the results of this? And it sounds like if there's a, I know I'm talking, so you must also. If there's a non-disclosure, how does this work? Because like Lisa had mentioned, things like having accurate information about what is going on, so that those of us who advocate for things like grants and with legislators and things like that, we can have that information at our fingertips to say, this is what we're facing. And if it has to be model by model, how do we set something in motion to where we can use that? Because very clearly, like the family child care, hey, Nene, can you give me 2 minutes before you sing? Please. It's the family child care result is going to look much different than something in a large center. And so I understand the need to take it model by model and not globally. But how do we use this in a way that people actually see that the work is being done?
Yeah, excellent. Yes, the timing is now. So we have it ready, we have the staff ready, and we are just this week had a discussion about, okay, what wages would we want to plug in? But I think that's where this panel comes into key importance, right? Informing some of the assumptions we made based on the research we're finding and saying, let's try this, or I don't know about that as a baseline. And so I think getting your feedback first on what knobs we turn, to what degree, what do we want to see? What would you guys like to explore? Then we plug that in and then we can share the outputs. Absolutely. We can share the data, and I can even come and we can run through it together. But it's more like handing over the spreadsheet and is the challenge. So yeah, I think we're very close, and could use some guidance on what you would like to explore for the different program types, and then we can set that in, plug it in, and come back with some results and discuss
So
them.
would this be one of those things like you could come to like a CCTC meeting, like one of our board meetings, and show us the data that pertains to our needs? Because I mean, we're in a situation, we need info, and we need to be able to speak knowledgeably now. And so I feel like if there could be some action steps, tangible action steps, I would love to participate in some of that.
That's excellent. Yes, Emily, thank you. And I think I discern an invitation in there. Would be happy to come.
Okay, perfect. Next we have Dominique.
Good morning, I'm Dominique Lewis. I am a consultant for some nonprofit early childhood programs on both the Kansas and Missouri side. And something that I would just want to encourage your team to do is exploring the employee benefits, particularly around offering insurance and those types of things for employees. I'm really seeing agencies be creative about improving wages. I think there's still a ways to go, but the insurance, I mean, that figuring out options there, I think would really help move the needle for a lot of child development agencies and services, even family childcare homes who have other employees.
Dominique, that's just the kind of input we're looking for. Is what do you all want to see and think we should adjust and then experiment with? Like, I think, and then that gets in back to what Emily's question was. Well, what about the differences between the center and family childcare? And we know that some of those benefit costs, for instance, are absorbed, right? But what if we were to say, as part of the system, let's turn on benefits in different ways? What would that cost the system? So thank you for that advice, and I might follow up at some point to get some more detailed suggestions on what to explore there.
Perfect. Next we have Nichelle.
Yes, this is Nichelle. On the narrow cost analysis, which will be published, Simon Workman does have proposed amounts that he used to do the narrow cost analysis for different salary levels. He used salary levels as indicated from the last market rate survey, but he also used and plugged in some of the scenarios the Bureau of Labor Statistics salaries, and he did include he did include some of the benefits that he would expect providers, and he has in this narrow cost analysis a number of different scenarios with different levels of salaries and different benefit packages. And so that will be out there too, Jenny. We have to wait to publish it, but it'll be out there eventually.
That's great to hear. That's really exciting. Yes, and thanks for highlighting that. We and a lot of his work is based on national research, so that's where that strength will come in, is understanding where some of those recommendations come from. I am not sure who's next. I'm going to lean on my team here.
Yeah, that's all right. I believe it's Eldana.
Thank you. So I was really excited to hear that DCF's looking at the subsidy rate, et cetera, and I understand that you said it's a systems level. I think that Emily made a great point, homes versus centers. I guess my question is, still keeping it at a higher level, but are you going to be looking at individual counties? Because obviously the benefits and the wages and the options for daycare in Johnson County are way different than they are in Western Kansas. And so I was wondering if we're going to be able to look at the data on a county level.
That's another excellent question. So there's a lot to unpack there. I think one thing I will say is I know the work, for instance, that DCF does on the narrow cost analysis market rate survey and looking at the cost of care to inform subsidy rates does look at all of that regional county level data to inform decisions. For the model, for the modeling that we could do together to look at costs, we can explore many different scenarios geographically. So for instance, we could say, we want to hone in and look at what if the conditions in X counties versus the whole state. We can try that out. What we would need input on, and I think what would be helpful would be trying to decide if we were imagining those possible futures, what do we need to consider different costs versus different wage scales, for instance, depending on the location. I think there's some research that would suggest that having keeping it statewide would be beneficial when it comes to competition and conditions that are set up when you make them different. There's a lot to talk about there. So I think probably the summary would be, yes, we can look at different outputs or scenarios at the county level, but some of what we're doing ahead of running scenarios is actually pulling in all the different county variations and weighting them based on population and other factors to then come up with an estimate for a wage scale that would work across the state. I confused myself when saying all that, so I hope that made some sense. And I think maybe what would be helpful is to run some examples and kind of bring those concrete examples back to you, and then to pull in our some of our quantitative experts to help explain it a little bit better. So apologies and gratitude for your patience as I muddled through that.
Next, we have Stephanie.
Hi, my question is about professional development. Is that one of the variables that you're looking at, and ongoing, and how that can impact quality?
Oh, Stephanie, that's great. Yes. So again, the model that we have, which is just a foundational tool for us to use with to inform these discussions, does have a place where we can plug in both. It already sets some assumptions based on some of the research that Simon Workman brought from the national level on what the average center or and family child care in theory should, like a profile should have available for days coverage, substitute coverage, things like that. We can adjust that, but for now we can kind of keep those conditions based on that. What we can also, but we can increase that. What he would suggest is for to run a scenario on what we might want for a better future. Talk to providers, look at the research and say, what would in an ideal situation would we, how much sub coverage, how much professional development would we have? And then also we can plug in, well, what are some revenue sources we already know the system has to cover some of those expenses? So we can plug them in both on the expense and the future we're trying to imagine, and then also we can plug in possible revenue sources. And since Nikki's here, I think I'll also just want to defer defer to DCF when it comes to, I know in the cost modeling is definitely taking that to inform future planning and subsidy rates. The cost model that they're working on with Simon definitely looks at that as well. So when estimating the impact at the end of the day on a child care provider and how the state needs to, it's how the system can anticipate the impact of additional professional development.
Well, and I think not only at the program level, but also individually as a benefit for employees to better their own education and as a benefit to attract people into our field too.
Excellent. Yes. And I know the career pathway, perhaps we can hear more about that too later, but we can plug in any of those things to look at it. Now, the individual would be based on the how on the profiles we set up for a center or the family child care unit. So it would do the math based on that, right? So let's plug in incentives and see how much that would cost at the state level to serve X number of children in our system. So thank you.
Emily, did you still have a question?
Yes, kind of. I think most of it got answered. I had 2 kids who needed to go potty. So back to the whole county thing, my question really came into like the disparities. There is a price disparity between some of the more rural areas and places like Johnson County, where I earn a lot more. Oh, my friend. I earn a lot more than some of my peers in other areas. You are super sad. I'm very sorry. But we also have the reality that, like, in certain, we're not going to talk today. In certain out there, and that's not 100% reflective of their per capita. That so is it going to be one of those that we can see that yes, what they have is lower population, but they also have a very, very out of proportion availability. Is that going to help talk about that?
Yes. So let me think more about this. I think this is something we've been, I think that question is something we wrestle with, what to plug in. We basically, so in the cost model, we're plugging in real time, not real time, but the most recent available license capacity. We can plug in desired capacity if that helps for each, and again, that would be for each county, so the data on each county. And what that's doing is whenever we can toggle let's say, the environment on and off, right? We can say, this is what to the best of our knowledge, what we know the rates are, like what are families paying, how many children are able to be served. We can toggle on, like, we want to see real time and just change this one other thing, benefits, right? And see what that costs. Or we can we can plug in and say, okay, I'm going to say, let's wave a magic wand and say we're going to serve 100% capacity, and we're going to reach all that's possible when it comes to the amount of revenue coming in from subsidy, et cetera. And we are going to turn on XYZ and look at that as well. When we talk about the county level outputs, we can focus in on a county and look at those conditions and making the intervention at that county level. And I think I would want to try that out a little bit first to really, before I feel confident saying that it would be the most useful for our goals. But we can certainly do that. And I think that I feel like that's an action item, is I'll go back to the team and say, we're really interested in looking at the differences at the county level. And how can we set ourselves up to be able to run some different test case scenarios that tell the story at both the statewide and the county level. So thank you. I think that this is really helpful calls to action. and insights onto what I think is a priority for us to try out first.
I should just add, when you talked about the ratios, we have the licensed availability. So in our pre-K classroom, for example, we have the capacity to serve 24 kids. For quality, however, we only serve 20. And so something that's going to be able to show the difference in that. And our parents, of course, are they going to pay for the extra 4 kids, spots that we have, for those children? Where is that money coming from? And we have that's where our grant dollars or et cetera go to help cover, the cost of care, for those 4 vacant slots, that we have because of quality. And that happens in all of the classrooms. And so being able to look at ratio when it comes to what is capacity versus what is quality, I think is going to be helpful as well, because quality does mean more lower teacher-child ratio, for sure.
Right. That's excellent. Thank you, Cornelia. I think that that will add that into our scenarios then, is to run those different capacities and show the gap. That is something that in a test run, we did see that already. There's about, when you run using current market rate surveys, there is a pretty big gap between what tuition and other revenue sources are funding versus somehow centers. There's about 70% is covered by revenue for centers, and I think it was even less when we ran the model for family childcare. So we know those are getting covered. That gap is getting closed for operational basis. For the most basic needs somehow. And it sounds like grants is one way. And then probably absorbing the costs through rent, for instance, and partner health insurance plans are covering it in other ways. So those are important factors to take in. I am afraid I might have gone over my time, but it's a rich discussion and really helpful.
This has been very helpful. The last question that I have for you, Jenny, is there anything more that we can do to help you as you are ready to launch, this model? Is there information that we can provide, either in planning for our next meeting or in sending you information, or what can we do in terms of just giving you everything that you can to be successful, with this model and be able to gather the data you need?
I think that's a great question. I really feel so appreciative. I think if you continue to think about what the future is you'd envision, if there are practices, I think it was Dominique maybe who mentioned there's some interesting creative things that programs are doing or communities are doing when it comes to compensation solutions and quality, as you mentioned, the lower ratios. Just jot those down, and maybe, I don't know, Hannah could collect them, or you can email me directly, and we can try them out. I think there's there's low risk here, and just taking the system that you would like to envision. For instance, what if across the state we could imagine this future, and we can plug it in and see, what does that look like? What does it mean? And then I'll take all these considerations into mind back to the team and see how many different variations we can come back to the drawing table. And I think we'd love to come back and talk more.
Okay, perfect. So our action item is to think and be creative and come up with the what ifs, and send you all of the different scenarios, different things to be considered, so that you have different things to plug into your system.
Thank you so much.
Okay, perfect. Okay, great. Well, that was actually very helpful, and so I appreciate that. I am very excited to see what the statewide, what it will look like from a state perspective, for sure, and definitely can use that from an advocacy perspective for sure. And this is how much the cost of care is versus this is how much we're receiving, and so that's amazing. But it's a very nice segue, as you mentioned, to our next presentation, and that is on the Child Care Aware of Kansas budgeting tool. And so there was a question about individual programs and wanting to be able to develop, figure out the cost of care for individual programs. And okay, I'm sorry, we're going to flip, but we're going to do first the update on the Child Care workforce appreciation bonus. And so we all know that one of the recommendations actually from our panel was a appreciation bonus for child care workers. And we're going to have Drew Duncan, who is the interim bureau director from the Family Health KDHE department, who is going to give an update on the workforce appreciation bonuses.
Yeah, good morning. Thank you for having me. As mentioned, I'm Drew Duncan. I'm serving as the interim bureau director for Family Health. I will give this overview and I won't read verbatim from the slides. We were asked, we gave a presentation to the Joint Committee on Child Welfare Oversight on Tuesday, and Hannah asked me to give this presentation this morning. So I'll work through, there's some things that are more informational, but if you have any questions, feel free to ask. I'm on day 10 or 11 of this role, so I will do my best to answer questions, and if I don't have one, I'll get with someone who does. So yeah, so next slide, we'll just jump right into it. So we wanted to highlight the significance of this child care bonus program. Of course, child care is a critical component of the Kansas economy, and really felt that something was needed to be done, as you mentioned, to support staffing, retention, and the recruitment of childcare staff. And so here are a few goals that were highlighted from this program. Hope to reduce some of the gaps in the wage disparities that we know exist, and that have been already, it sounds like, discussed here this morning. Increase the retention of new and long-term staff, increase the stability of the workforce in the childcare facilities, and then lastly there to provide a boost to the Kansas economy. And then on the next slide, a little bit of background information that most of you may or may not know. But again, the bonus program is an opportunity to recognize childcare workers and their commitment to the field of early childhood. Individuals are eligible to receive up to $2,500 based on some eligibility requirements, and applications that will be accepted through December 10th, 2022 at 5 p.m. And there are the respective roles. DCF is the funder, KDHE is kind of administering the program, and Child Care Aware is there for technical assistance and support. Next slide. And here are a few of the eligibility requirements. Again, I will not read through those explicitly for you, but if you have questions here, we have, you do have to be currently working or working some number of hours at the time that the application is being processed. That's been one of the questions that have come up often. At the time, working at the time of submitting your application is not the same as at the time that it's being reviewed. And so that is a clear distinction between being eligible and not eligible. Here are the application schedule and phases. This is done to kind of support the back-end staff. However, if someone were to apply outside of their scheduled timeframe, the application would be processed in a manner that it was received as well. But this was done to kind of try to work through the applications and the number of applicants in a timely and organized manner. And here is the number of estimated eligible workers. You can see they're a little under 22,000 total across the different licensing types and programs. Promotion and outreach, you see here a number of ways that the program has been promoted. A news release through Governor Kelly's office, social media posts. We have a website that was launched and maintained by Child Care Aware with frequently asked questions. Several webinars were done to promote this. Emails have gone out to over 12,000 potentially eligible workers. Say potential because there is a chance that some may have received notification and may not be eligible. It's also possible that there's some that haven't received an email that would be eligible as well. But a number of methods taking place to advertise and promote, and continuing to work with Child Care Aware and DCF on other methods to promote as well. This is just a kind of a rundown of the application process, so I won't read through that for you. They did discontinue direct deposit as of July 29th, I believe due to, again, a number of issues with the direct deposit forms. And so we feel like on the KDHE side that moving to the paper checks will improve our process with getting those payments out to individuals. Commonly asked questions here, no requirements for how the money must be spent. It is taxable income. The payment also does go to the individual, not the facility. And a facility's licensing compliance history does not impact the eligibility for the applicant. Some ongoing challenges and solutions that are paired with those. It is an online application. We have seen some issues with some being able to navigate from the technical side, but Child Care Aware has been great in supporting that and is there to help individuals navigate that process. Another issue that we've faced is applicants not being verified in Claris, which is the child care licensing data system, because facilities have not updated or submitted that information. And so individuals may receive not eligible based on this reason, and they are directed to work with Child Care Aware or their facility to get that information updated so that we can approve that application. And then lastly, as I mentioned before, some of the individuals who have applied and are no longer working at the time of verification, which would make them ineligible. Child Care Aware's contact information for technical assistance and support. And then lastly, here's just a little bit of data related to the program. Received over 7,700 applications. About 90 applicants have been told they're potentially ineligible. Again, that may be because their information has not been verified in the system. And so once we're able to verify, then that number could come down. To date, we've routed approximately 4,700 applications representing $11 million and dispersed a little under $1 million to date. And there you can see some technical assistance numbers that were provided by Child Care Aware. I think that is it. So I'll answer some questions if you have them and do my best to answer them anyways. Yeah, Eldana.
Good morning. I'm Eldana Chestnut, and I represent Johnson County, Miami County Child Care Licensing. And so we had a provider meeting this week, and there was some concerns voiced about that they have submitted their application. They believe that everything is current and Claris, but they haven't heard anything and haven't received payment. So I don't know if you can talk about, their time frame expectation or what they should do.
Sure. I think if when things are going perfectly smoothly, it's been about 45 days, but there have been some back end issues. So, definitely have them. I guess if it gets too long, they can follow up with the channels and request some feedback. But they're switching from the direct deposits to paper applications. That's streamlined some process on KDHE side. It's slowed down the process on the Department of Administration side, processing W-9s to get them set up for payment. So that there are some back end things that we're working through, but if things are working as they should, it's been about 45 days is the estimate we've gotten from fiscal.
Okay, thank you.
Mm-hmm.
So Drew, if the change to paper check, does that mean that anybody that initially submitted information for direct deposit will be getting a paper check instead, or will those who submitted direct deposit get direct deposit?
Those who submitted direct deposit up to that date will still receive direct deposit. And then after that date, any new applications will receive a paper check.
Okay, good. Any other questions?
I have a question. I couldn't find the hand emoji. And excuse me if I missed this. Is there any plans to track of the teachers or the educators who received this, if they're still employed 6 months from now, a year from now?
That's an excellent question. I don't think that's a component of this right now. I wouldn't say that that's not a consideration to look at down the line. I think that the initial thought process is how do we get this program in place quickly and get the funds dispersed in a timely manner. And so I'm very data minded. So I would love to know those things. And I think that some of the chain would love to know those as well. So I think those are conversations that we'll continue to have, but it's not been in the discussions that I've been involved in my 10 days at this point. But that's a great question.
Thanks. And I should have loved this is just so exciting, and to see that those big numbers, it's really encouraging for the field and for all the work we do. So thanks for being a part of it in your 10 days.
Yeah, well, thank you for letting me come and talk with you all this morning.
Any other questions for Drew?
Awesome. That wasn't too hard. I appreciate it. Thank you again.
No, very
You
good.
guys
Well,
have a
thank
good
you.
weekend.
Thank you. Okay, now we're going to segue into our child care budget tool. There was a question raised earlier when we were giving it over, when there was an overview of the statewide, budgeting information that was being, presented by Jenny. And so now we're going to talk about it from a program level. And so if you're really wanting to look at the cost of providing program, this is maybe a tool that will be helpful for you in doing that. And so we will have, sorry, my papers got mixed up here. I got excited looking at the appreciation bonus. And so we're going to have Laura Prater and Tanya Kane from Child Care Aware of Kansas, who will share more information about a budgeting tool that we could all possibly use to be able to help us really determine the cost of our care.
Thank you. We are excited to be here today to kind of highlight and talk to you a little bit about our child care budgeting tool we've got for Child Care Aware of Kansas. My name is Tanya Kane, and I'm just going to do a quick introduction and then hand it over for Laura. So Child Care Aware of Kansas created this tool a few months ago, really to assist our when we were working with communities who were trying to figure out how to budget to help childcare in their community, whether they were working to figure out what childcare costs to start a childcare program, or just they were spinning their wheels trying to figure out if we're going to be helping new providers, how much money do they need, what's that kind of look like. And our child care community outreach and engagement people that went out and worked with communities just found that every time they attended the meeting after meeting, communities were stuck. So we, several of us at Child Care Aware of Kansas kind of got together and started to work on this tool. It's been piloted over the last several months. So our community outreach and engagement coordinators have been out working with communities side by side with this tool. So it's been through a few edits, which we're thankful for. Communities are like, we need this, or it would be really helpful if it had this on there. And so now we're ready to kind of take it and put it on our website. It's actually now on our website, but we've also found that providers, whether existing providers or new providers coming in the field, have also found it to be very helpful. So not only are we using it now with communities, we're using it with new providers and existing providers. So I am going to let Laura Prater take over here. She's the lead data specialist that was on this project to help kind of do a lot of the back end of the data for this. So I'll let you take it away, Laura.
Thanks, Tanya. So like Tanya had said, we were in communities, and, once that community was making a decision, or a provider, because we've found that this works at the individual level as well. Once they make that decision to move forward with opening a childcare business, we step in and we support them with our knowledge and information in the industry and what it takes to start that childcare business. And importantly, we want to support the sustainability of that business. So from the community standpoint, many of them rely on grants and private funders to get those businesses off the ground. And so this budget tool initially was thought to help them with that process, and then, the possibilities that grew from that. So we wanted to help them with their expected startup expenses. And, we even found that it was helpful in determining communities might be better off opening multiple group homes versus a childcare center. So this budget tool was really just created to help navigate those first steps of determining what that business was going to look like as they moved forward. So we really wanted to provide a tool of value in that initial process. So we're able to help manipulate different scenarios with our budget tool to help them determine what their startup budget should consist of. If you want to move forward to the next slide. Thank you. So one thing we recognized, as Tanya said, is that communities were getting stuck and they would get to the point where they would, maybe find a property or, determine that they were ready to move forward, but they didn't know what to do but beyond that. So, what goes inside the building and what all does it take to open a daycare, and how would they make sure that their financial needs were met on a monthly basis? And so our goal was to help the decision makers think beyond the walls of the building and help paint that picture of what happens inside the building once that facility was open. We really just created this to help take them through that financial process. So the startup expenses worksheet that we'll show you here in just a moment, combined with the budget worksheets, created a guide to those questions to move those childcare providers forward or those communities forward in creating their early childhood program budget. So if you want to go ahead to the next slide. So like I mentioned, the startup expenses. So when we first started brainstorming around what this would look like, we wanted to have some up-to-date and accurate information. So we reached out, we want to take them from the beginning to the end. So we recognize that it might be necessary to build a new building or find a separate building for centers and for communities. And so we reached out to different building companies across the Midwest to get estimates for the cost of purchasing maybe like a new modular classroom versus building on site. And then we created a list of necessities of what those would look like. So maybe a minimum square footage of 1,200 square feet, and they need a bathroom and a kitchen and a laundry facility, and what that would look like. And then we took that information and created like an initial building expense if they were wanting to start all the way from scratch with a new building. Obviously, these fields are editable. So you'll see on this PowerPoint, anything in green is an editable field. So if they are doing this from their home, they can simply zero those out and have that information. But we really wanted to take them through that full process. And then we also wanted to provide a list of those basic facility requirements, the equipment they're going to need, fire extinguishers, first aid supplies, changing tables, everything that would go inside of that building. We wanted to make sure that we created a really in-depth list and allowed them to really come down to that final number of what it's going to cost to start that business. So like all businesses, balancing the money coming in and the money going out is vital, to the sustainability and long-term success of the business, and childcare is no exception to that. And so, providers often focus on their rates and their enrollment to ensure they're covering those costs for their expenses. So when designing the budget tool, we implemented that concept of the opportunities exchange created, the iron triangle, which is how to imbalance those enrollment numbers with the operating expenses. So we talked about professional development, we talked about vacation time and benefits, and what that would look like all the way down to a group home, providing those opportunities for that second or third person working even within those group homes. So the biggest chunk of that revenue is going to come from those tuition costs, but it isn't very helpful if you're not filling those spots. So if you're paying staff in a center for, working an entire room, but you're only filling that capacity at 60%, then you're going to be losing money. So we wanted to help them find that balance using that concept of the iron triangle. Even going down to our discount options available when you're enrolling families, and what needs to be determined and how that fits into the budget before that decision is even made as far as rates and discounts. And then that final side of the iron triangle there is the cost per child, and making sure that they are charged those fees and they're bringing those fees in. So with all that in mind, the facilities can manipulate those numbers to capitalize on that bottom line and meeting those needs, within their community, because we initially started this for a community piece, but now even those individual and small centers, what what can they do to capitalize on that and meet those needs at the same time. So this budget tool was really created to help them find that sweet spot to managing their revenue and expenses and becoming self-sustaining. So this here is what we're looking at is the budget template. So as you can see at the bottom, we do have a group family home. So we've got the family and then a center calculation. So it provides both of those. So we talked about, is it more advantageous to open, for communities to open multiple group homes versus one center? Working both of these worksheets are able to help them come down to those bottom lines. So they can even consider the cost of employee vacations and benefits, ratios to meet the supply demand, weekly rates to meet those budget needs. And a couple of things is that we also included DCF subsidy and food program reimbursements. And when we did that, we used those current rates. So we'll have to keep those updated. And as programs get enrolled and they find out more information on what those look like, they can manipulate those within the spreadsheet as well. So, and then these numbers can be altered so that, they can be determined on a case-by-case basis. And then this allows the user to look at, different approaches to meeting their needs and the childcare needs in their area. Thank you. So once all the information is entered in the budget calculation tool, the information is then put into the budget template and it auto-populates all the transferred data from that calculator. And it allows for the user to manage those numbers and figure out how much, in communities or in larger centers, how much grant funding they might need from partners or donations or contributions. On a smaller scale, what are they going to be able to meet their needs with their enrollment numbers and their weekly rates. And then in the final step of the budget template, they're able to finish painting that picture with, is it the next, can you go to the next slide? Okay, sorry, I thought it was on the next slide. So thank you. So then they're able to talk about, we talk about inflation and what things are going to look like next year. So then they can even go in and they can say, okay, next year we need to see 5% increase and what those numbers will look like and how that'll meet their needs and how to prepare for their next annual budget as well. One thing that we just recently added, and it's not on the slide, is we did add a tab to the end of the worksheet for employee costs. So it puts in their annual salaries and then it feeds that back into that budget calculator so that you can manipulate those numbers as well, all the way down from classroom staff and administrative staff to the directors. So it really encompasses what that employee package would look like and feeds that back into the budget template as well. So what questions? I know I went through that really fast. So we've received some great feedback from communities and we put this calculator to use and we have officially published it on our website for communities and individual providers to use when they're opening their childcare businesses. So we definitely invite you to go take a look at that in your spare time. What questions can we answer? I know I went through that pretty quickly.
Laura, can you tell us, this is Hannah McGahee. Laura, can you tell us where we can find this tool on the website?
Sure. It is under the new provider supports under business administration. So if you go to the ks.childcareaware.org website, it's available under new provider resources. So under providers. And then there's a business administration section and it's located there.
Any other questions? No, well, thank you for the tool and for developing this. I know that it's going to be very helpful for people in terms of just calculating the cost of care, especially being able to do that forward thinking and looking at, what's coming next year, because we know that things are going to be looking different next year as cost of everything is increasing. And so thank you for that. Our last presentation is on the career pathway. And so we're going to have an update on a career pathway. And this has been, I want to stop and just say that this is actually great to get all of the updates on everything that's been happening in the state of Kansas. And so that's amazing. And so the next update is for our career pathway. And we have our very own Miss Hannah McGahee, who is going to give us an update on that.
Thank you, Cornelia. Let's see if I can talk and advance my own slides today. So the hat that I am wearing right now is Workforce Coordinator. One of the projects that I've been involved with for almost 2 years now is the Career Pathway. Many of you have been directly involved in this. You've either attended a feedback session or we went to you specifically with your agency and had very specific feedback that we were looking for based on your subject matter expertise. So I'm hoping that this is familiar to most of you. I'm really wanting to prime you guys for some of the things that have changed. And then actually we're going to walk through a table that has the best representation of the child care career pathway on it. And so we'll go over some of these elements again, but yeah, so we'll do that. I'm trying to think of my strategy here. So for those of you who have been a part of these conversations, you might remember that we did have master's degree and PhD included in the career pathway. And so those were levels 8 and 9. Throughout our feedback sessions, throughout these larger conversations, we learned that maybe necessarily was not reflective of the workforce or relevant for this phase of implementation. So not saying that we aren't going to encounter childcare providers that have master's degrees and have, a whole lot of education, but that our focus right now is really from that pre-professional to the bachelor's degree, so that we can be really reflective of our workforce. And so another thing that changed, and I'm going to show you this as well, but like I said, I'm going to prime you, is that we tried really, really hard to create alternative options all the way through the pathway for higher education as well as alternatives, right? And so that was a combination of professional learning, like professional development hours, stackable or portable credentials like the CDA, NAFC accreditation, et cetera. But one of the modifications was after level 5, we do not have alternative options beyond higher education. And so I'll talk about that again, but I just want to, prepare you for that modification. And the reason being, we did extensive work around trying to find something that would fit. But for this first phase of implementation, throughout conversations with higher education, with many of you, we couldn't really find stackable credentials that would equate directly to, let's say, an associate's degree. And so that was kind of a struggle for us. And we talked to ECHO and EQUIP, which are the 2 and 4 year professional organizations. We went to the experts and we tried to find ways that we could equate those accomplishments, but just not something that we could put our finger on right now. So certainly, we're very open to future iterations of the child care career pathway, including alternative accomplishments that are equitable to that associate's degree and higher, but right now we just don't have them. So that's another change that you're going to see. We also heard in our feedback sessions that what is now being called the pre-professional level, which includes a high school diploma or a GED, and then on the alternative pathway would be a CTE student. So somebody who is not a legal adult that is, well, they could be a legal adult, but a high schooler who is participating in the CTE program would be the alternative option. So we modified that from being level 1, and now those are the pre-professional, and we don't have some of the same stringent restrictions about professional learning or other accomplishments. It's really just kind of a way to introduce those people into the workforce, get them to start using some of the future tools that we plan on having, like the workforce registry, like the individualized professional development plan that Casito built, et cetera. So we did modify that. Another important change is that we removed the certificate of mastery from this first phase of the career pathway. And so I want to be very clear that this idea is not going away. And just as a reminder, a refresher of the certificate of mastery, we heard pretty unequivocally that our providers who have maybe no higher education or have just spent years and years in the field and are subject matter experts through professional development, through lived experiences, should be valued just based on their experience. And so initially, and for like the last 18 months, 18 months, we were fleshing out this idea of a certificate of mastery. And so the intent there was a progression of advanced learning for those experienced providers in the field who maybe were not interested in higher education or were not going to pursue a foundational credential like the CDA and wanted to show off their mastery and be recognized. So the problem that we've run into at this phase of development of the pathway is creating an entire new certificate is going to be a huge lift. And so we're really just concerting our efforts on what we know is working within our system. And so we're hoping that in a later phase, we can bring this effort back. We can try and find maybe more stackable credentials or other accomplishments that are transferable outside of the state of Kansas that could achieve the same goals of recognizing those experienced providers who are subject matter experts in their field without penalizing them for maybe not being interested in higher education or not having the opportunity to pursue a degree right now. So it is being tabled for right now, almost entirely just based on resources and the amount of work that we have in front of us, especially to align the career pathway efforts to the workforce registry rollout. So just in full transparency, it's off the table for right now. And then you'll also see on the left in this little table that I'm going to share that we did do a crosswalk to power to the profession, the NACI levels. And so you can see where our pathway speaks to those levels off to the side, as well as director's credential and a few other stackable credentials and portable credentials that we know our providers are using and accomplishing in the field. So you'll see those and they are new. So I'm going to actually awkwardly and slowly stop share and we're going to move into a table. But if you are, if you have any questions up to this point, like I said, I know I'm assuming that we all have the same level of knowledge here, and that's not necessarily fair. So if there are any questions before we launch into the actual table. Okay. All right, can we all see this very pretty table? All right, and it's not very large, so let me see if I can get a little better view here. And just to be 100% transparent, this is not in any way a prettied up version of how our career pathway is going to look. This is just a way that our team can organize our thoughts and talk about the career pathway in a succinct way. So if we look here, these are the levels. And as I discussed, you see that there's pre-professional, and that's the high school diploma or the career and technical education program participant. We did add a moderate amount of professional learning hours for those participants, just so that way we can ensure in the future, if we're awarding maybe stipends, bonuses, things like that, that it's kind of a way that we can ensure people who are not in the workforce are benefiting from those, right? So we want to make sure that people who are participating in the career pathway, maybe they're part of the registry, have conducted some workforce relevant experiences, and that'll help keep our data clean as well. And you'll see here over on the right side that we do have recommendations for some additional professional supports like job embedded coaching, mentoring, and then participation in some small group advisory type environments. And so examples of that small group advisory would be really any existing professional group that meets, like this one, like CCPC, like those of you who are maybe members of KSAEYC, really anywhere that a provider is going to collaborate, learn, grow, peer-to-peer mentorship, right, with people who are going through the same thing. So we really want to encourage our providers to be participating in existing communities of practice where they can learn and grow and support one another. And I think almost most importantly, advocate. So we'll talk about those in just a second. There are some levels here we do have recommendations about when those professional supports should be utilized. As I mentioned on the left, there's a little crosswalk that was done to the unifying framework, just to kind of give you an idea of how we could align in the future to those ECE 1, 2, and 3. And if you see numbers here, right? So if you're looking at the professional learning hours or the experience numbers, don't get hung up on the numbers. These are, you know, we've talked quite a bit about these specific 45 hours versus 30 hours of professional learning, but nothing is set in stone at this point. This is just kind of the trajectory of the vision. You'll see at level 3, we have the introduction of the CDA. Another kind of visual tool that you might notice on this table is that there's some text that's grayed out. And so the purpose of that text is that it's implied, right? So if you look at 3 specifically, 3 alt, we know that there's 120 hours of professional learning that have to be completed and submitted with that portfolio to get your CDA. And so what we are not saying is that you have to do an additional 120 hours on top of your CDA to get on the pathway. These are the requirements, that grayed out text are the requirements of the council. Okay, so these are things that somebody would have to be doing anyway if they were pursuing a CDA. We also have, you'll see here that we have at level 3, it's a great example of the way that we've tried to kind of scaffold the higher education path to also include relevant professional learning. So even if you're coming into the pathway and you do have early childhood credits, you know, more than likely that professional is going to be completing some professional learning hours for their licensure anyway. But we think it's important that that person who could have some old college credit is getting some relevant community-based learning or professional development ongoing. You'll see here as we keep moving through that level 4 is the CDA with enhancements. And so we talked about this in other conversations and with many of you, but just as a reminder, the CDA with enhancements, really the only significant difference between the CDA and then the CDA with enhancements is that we really think coaching and participation in those small group advisories, mentoring is important for somebody who's going through that process. And so the addition, the enhancements are really just so that CDA candidate is getting those professional supports as they're going through the process. Level 5, we talked about level 5. So this is where you would have seen the certificate of mastery. And you can see here on 5 alt that we've kind of left the placeholder of kind of that general amount of professional learning, but we don't have that certificate of mastery living there anymore. But you will see that we have done some crosswalks, like with the director's credential, the McCormick Center, and then Aim for Excellence Director, saying that these are equitable at this level. Also, I totally skimmed over this, but we did add NAFC accreditation, which I'm really excited about, at 4 alt, because we know that first of all, NAFC is a huge lift, and it's also 120 hours of professional learning, but we missed that, right? So we missed that on our first round of work on this, and thankfully we had great feedback sessions and people said, you know, I've worked really hard on NAFC, where is this? So it is now reflected on the pathway. And then we also have, as I said, so we don't see 8 and 9 anymore. Those were the 2 levels that were taken away because they were master's and then PhD. We have level 6, which is a bachelor's degree or higher in any area with a specific amount of early childhood credits, and then another option for 7 with a little bit more stringent kind of additional requirements. Another recommendation that we included in a change is that at that level 7, right, because this is kind of the highest tier of professionalism that we have on this career pathway, we do recommend that that person is practicing in a professional leadership position. So we don't know necessarily what that's going to be, if that's a center director, if that's, you know, somebody who's working in a supervisory role. But then there's also a recommendation for participation in leadership or advocacy activities, because we think that's really important. People who are at that level of professionalism, and especially if you're working in a supervisory or a position of authority, well, the rest of the workforce needs that knowledge and that guidance and the mentorship. So we'd like to see more vehicles created for peer-to-peer mentorship that happen naturally. And then here's some general assumptions that we've just been working with, and they've kind of changed as we've gone through, but just kind of keep us grounded in our work. So example, one assumption is that the CDA or the accreditation that we're talking about, whether that's NAFC or director's credential, whatever, if it's on the pathway, we expect it to be current. So if you have a CDA, you know, the expectation would be that if you want to stay at level 3 or level 4 with the enhancement, is that you're keeping that credential renewed and active. And then another assumption that that we have that's reflected throughout this is that professional learning hours would be aligned with the existing Kansas, Missouri core competencies or whatever future iteration exists. So we think it's important that we state that our professional learning is aligned to the core competencies so that we can try and ensure some level of quality. So for the purposes of time, I am not going to get too far into the weeds with this table, and I'm going to go back to my presentation over here. I'm hoping that we do have a few minutes for some questions. But then we're going to launch into kind of what we're doing next and how we hope the panel can be involved in what's coming next. There we go. I am not getting any better at this, guys. You'd think after 2 years that I'd be a little bit quicker, but I am not. Okay, so here's some ongoing work that's happening in tandem. The Workforce Development Advisory Group has been working tirelessly on the core competencies. The career pathway team just had a meeting with them. I don't know, I think it was this week. It could have been last week. My brain is not incredibly firm these days. So we are actively conversing with those that are involved in the core competency efforts, just to make sure that if there are alignment pieces with the career pathway and with the registry, that we're capitalizing on those ways that we can align. And then another piece of system work that I'm really excited about is the development of maybe like a 2-pager career guide type of thing. So I don't know if you all are aware or not, but Child Care Aware of Kansas actually has a career guide published on their website. I'm going to include it in our follow-up emails with a bunch of other stuff that we talked about today. So there is an existing career guide, and we believe the career pathway team and the professional development implementation team, we believe that we kind of need to refresh whatever resources being released with the career pathway, and that a career guide is a great way to do that. So based on the conversation so far, for those of you who have looked at different career guides that states offer, some of them are like 120 pages long. That is not what we'll be working on right now. So maybe in the future, there will be a very comprehensive career guide that's dozens of pages, and it really goes through kind of the system and the workforce of Kansas. But one of the artifacts that we need to work on is a brief kind of highlight of here are some career opportunities that you can do in Kansas. We know that our providers have a variety of experiences, a variety of accomplishments, and that let's say a bachelor's degree or a certain amount of professional learning does not always equate to getting that job. And so we don't want to be too prescriptive in the career guide that we release with the pathway, but more just informational for somebody who's curious about the types of things they can do getting into this workforce. So I'm really happy. And Kelly, I don't know. I'm not looking at Kelly's face, which might be a good thing, but because I don't know if she's ready for this or not. But Kelly Davidoff with Child Care Aware of Kansas is agreed to. Her and her staff have agreed to put some energy into this product, this resource that will be released with the career pathway. And so over the next month or so, as things kind of shift as far as capacity over there, we're going to be working together to see what kind of tool we can create and hope to align it with once we start really talking about the career pathway with the system and talking to our providers about how they can use it. So I think that this is going to be a really great opportunity for the panel to be involved. And so my ask of you as the workforce coordinator and not the panel support person that I am, is to think about what career guides or artifacts you've seen that you like. What do you like about them? So if there's other states that have kind of a brief, 1 to 3 page type visual explaining the way that somebody could progress through their workforce or the types of, endeavors that they could set off on, we would love to see that. So you can email that to me and just say, hey, check this out and look through it. I am going to be, as part of my career pathway team responsibilities, I'm going to be supporting Kelly and her team by just kind of doing some research. So if there's something that you think another state or region has done very, very well in highlighting some of the opportunities in their workforce, send it over to me and we can talk about it. So those are 2 things that are happening right now that are really important. And as I don't even have a registry update on there, so I'm going to go ahead and give you one. But the registry, of course, is front of mind for alignment purposes. And thankfully, the people that I work with on registry stuff are most of the same people that I work with on career pathway stuff. So we are really trying to make sure that those 2 processes are happening in tandem so that we don't miss those alignment pieces. A lot of the resources are going to be the same. A lot of the messaging is going to be the same groups of people, the same avenues like panel, like webinars, like communities of practice. So there's a lot of work being done behind the scenes to try and make sure that we are doing the best we can to not waste time and energy. So the registry process is still in process, in negotiations. We have we're kind of in a holding pattern, just waiting to hear back. But we had a really, really great evaluation team and procurement team that was comprised of, I think, really representative of our subject matter experts here in the field and across state agencies. And so that whole RFP process was really, it was a deep dive, and I think that we got a good result. So excited to be able to share more with you when we get there, but things are still happening. And then finally, so specific to the career pathway work. So what we're doing right now is we continue to meet with that professional development implementation team, which is representatives from, well, we've got so many of them on here. So we've got Amy Meek from the Children's Cabinet. We have representatives from DCF, both on the links to quality side, as well as the, oh, I just blanked. I am so sorry. We have DCF, we have representatives from Child Care Aware, from Kansas Head Start. So we meet with them on a monthly basis. And then apart from that, we're also conducting independent strategy sessions with partners who are currently providing some of the resources that we're going to depend on during the rollout of the career pathway. So people who are already offering training, mentoring, coaching, etc. We're meeting with them to try and figure out what models have been working well, what's your current capacity, what are we going to need to do to increase capacity once the career pathway rolls out, and then just any ongoing concerns. So constantly in talks with our partners and iterating. We're also going to be embarking on a professional learning inventory just to kind of get a good idea of the types of professional learning that are available. And so one of the things that we heard and that we're keeping front of mind is that not all professional learning opportunities that are quality are KDHE approved. We know that there are some really great learning opportunities that fall outside of that parameter, like offerings by NACCE. And so we're trying to determine what the pool is where all of these professional learning hours are going to be coming from. And one of the biggest reasons that we're doing it right now is because we're going to need to know that for the registry anyway. We need to know who's going to have access to contribute to the training calendar so that providers can go into their registry profile and seamlessly sign up for training. So that professional learning opportunity is happening. And then, like I said, just continuing to meet with our partners and the people who are doing the work every single day in various state agencies, various contracted agencies, and just a lot of communication and alignment. So you guys are not going to be done hearing from me with this hat on. You're going to keep hearing snippets about the registry, about Career Pathway, and about specifically some of these resources and artifacts that we're going to be developing. And I see the panel playing a role in that rollout and that messaging and kind of how we're introducing this to the workforce. So stay tuned for more. If you are, as always, if you have questions, if you're interested, if you have things that you don't agree with, email me. I have heard it. We have talked to so many people and I have very thick skin. So if there's something that you see that you just doesn't sit right with you, we are not above making changes at this point. We continue to iterate. So that is what I have. And I know that we are so close to time, or we are over time, and I'm so sorry. So I can take a few questions if you guys have them. It's totally up to you. It's your time.
Okay, so Lisa's hand go up first.
In doing all of this work, the one thing that is not attached to it is state licensing requirements. And many times with continuing education, particularly as a center director, you're looking at your current year's licensing requirements. And is there a way to attach that to this? I realize it's a lot of work and it's another algorithm, but I'm not so sure that it's not a piece that's needed, particularly on the beginning staff level, because they look at the number of hours of continuing education required and they're like, oh, well, that's what I have to do this year.
So the career pathway at the individual level is reflective of basic KDHE regulations. So the basic amount of hours that somebody would have to complete, I can't specifically say for their employment because that's probably going to be dictated by the center. But as far as licensing regulations, the recommendations that we have put forth for what somebody needs to get, they will always be in good standing with licensing because it's a little bit above.
Thank you.
So that, yep. So that the first place that we see professional learning on the pathway is actually 30 hours. And so we know that in somebody's first year, they could accrue anywhere from 18 to 24 hours, kind of depending on if they do like the foundations module with Casito, that's 18. If you're on the food program, you have to do additional hours. So we've set that bar just a little bit higher than regulation. I believe Emily.
Sorry, I had trouble getting off mute. Not so much a question as just it's exciting to see the evolution of this. You know, having been involved in some of the conversations from the beginning, I'm excited to see how this is all developing and coming forward. So thank you for the hard work you're doing.
Thanks, Emily. It's been a labor of love. love this work. And I think the thing that I'm most appreciative of is the fact that you all are not groaning terribly audibly when I come back to you and say, can we sit down with your group again? So just the fact that everybody has been willing to continue to have these conversations. I know it's a lot, but if we don't get it right, we don't get it right. And that's not great for anybody. So, you know, myself and Rachel Sisson and Sarah Gardner, right, have been working on this. But really, if we didn't have people willing to take time out of their schedule to talk about this again, we would not have been able to come even remotely close to this. So kudos to all of you for being willing to continue to talk about something that's very difficult, and it's not black and white. So we appreciate you. Okay, Ms. Cornelia, that is all I have. I'm going to move into those two kind of random updates that we have.
Okay, so the first is that there is a childcare licensing feedback. Childcare licensing would like some feedback. And so there are proposed amendments to KAR 284114, and they would like to have written comments. So please go on ahead and review the regulation. Please provide comments, and they'll be accepting those comments through October 28th at 5 p.m. And so I love the fact that, we have the opportunity to give input, give our thoughts. And this is the one that is really in relation to childcare ratios. And so, that's important when we're looking at quality, but also cost. And so it'll be interesting to kind of see, what comes out of this. But please, please go on ahead and provide comment. And again, you have until October 28th at 5 o'clock to do that. And there are webinars. Webinar is going to be scheduled for licensed home providers on a Thursday, September 8th. And okay, we missed those. Okay, so there you go. There were webinars. And so the next update is that Title V Community Readiness Assessment Survey is available. And so parents of young children, they want to know whether or not, do we have what we need to succeed? They want people to share experience and be entered to win one of 250 $100 gift cards. And so you get a little extra money to spend or whatnot. And so please go on ahead and participate in the survey. The survey link is provided here, but where else, Hannah, can they get the survey link?
I'm going to send out the survey link as well as the feedback opportunity from KDHE and a few of the things we've mentioned in our follow-up panel email, hopefully this afternoon.
Perfect. Okay, good. Bright spots. Does anybody have any bright spots they would like to share? Pam?
I just had a bright spot that happened right now. My crisis nursery case manager came in my office to let me know that she had received $2,500 from Family Promise, which is a homeless shelter in Wichita that she serves through her crisis nursery program. And just as a pay it forward, and crisis nursery helps families, obviously, that are in crisis find quality childcare and whatnot. So that was just a really exciting Friday thing to happen. She is really a hard worker and does great. It's a CBCAP funded program.
Logan.
Hi, good morning, everyone. I'm gonna just talk about a really cool project that I'm excited about that I've been working on with Emily and the Child Care Provider Coalition. We submitted a grant recently through the American Heart Association to focus on an advocacy campaign that's really relevant to this career pathway discussion, because when we had some conversations, they brought up that mentorship and really incentivized mentorship was a program and investment that would be really supportive to the field with retention and recruitment, as well as hopefully trying to get mentorship hours, not just receiving mentorship, but actually giving mentorship as like KDHE approved hours. And so that's still potentially, so it's not a completely confirmed bright spot. But I think the bright spot too for me was the ideas we talked about in regards to the funding we would use for organizing and outreach to child care providers across the state and building up their capacity, which extends beyond just this one policy goal. And so I hope that even if we don't get this grant, that those ideas still live on and that we kind of make some ways to figure out how to make them happen and to connect more providers into advocacy and to building power. So I'm excited. That was a really cool partnership and we should find out soon.
Very cool. Thank you. Martis.
Another exciting partnership. We're very excited to partner with KCSL for a parent event in October about community conversations. So this is our first partnership with KCSL and we're excited and happy.
Very cool. Any other bright spots? Okay, I have a bright spot and information. And Hannah, if I am going rogue and talking about something I am not allowed to talk about, then just mute me, or like block me so that nobody can see what I'm see me or anything. And so you all may be aware that the federal government has a public service loan forgiveness program. One of the things that I've been working with as executive director here at TOP is trying to figure out how to get loan forgiveness for my teachers, because especially those that are licensed teachers, because they don't always qualify for the teacher loan forgiveness because we're not a school district. And so when the public service loan forgiveness program was launched, I thought, okay, that was a great opportunity because we're nonprofit and we're in education, and so that works. But there were a lot of loopholes that made it very difficult for people to actually qualify. So like I didn't qualify for it because they didn't have the right loan type, et cetera. And so there was an exception made to the criteria for public service loan forgiveness that launched last year. And people like myself who were not previously eligible for loan forgiveness, that worked in education, that worked for a nonprofit, or that worked for a public service entity, they could now qualify for loan forgiveness when they did not qualify before. So a lot of people aren't aware that there's actually been changes and there is this temporary expansion of qualifications. The temporary expansion actually ends October 31st. So you have until October 31st to actually apply, and then you have to make 10 years worth of payments on your student loans, and then 100% of your loan is forgiven. My bright spot is that yesterday my loans for my bachelor's and my master's were forgiven. And so no, tell me, like I would take my whole meeting and just like hoot and holler the whole time, like literally, no, that's crazy. So like life-changing, $500 a month, like literally that's life-changing. And so it actually is working. And so I want to share that just because I was one of those people that just didn't bother to look at the exceptions, at the extensions that they made or whatnot, and it worked. And so I just want to encourage you to do that, to let your staff know, for you to know or whatnot, that if you have not gone ahead and resubmitted an application, to go on ahead and do so, because it actually, it worked, it happened. And so, yeah, that is my bright spot. Emily.
First off, absolutely, congratulations. That is, you're telling her congratulations too.
Why, thank you.
That is absolutely wonderful. My question, I had never even thought about this concept for family childcare providers. Most of us are for-profit. Would a family childcare provider fall into this exception?
And I know that it says that you have to work for a nonprofit organization, a licensed you can be a licensed child care center. I don't know whether or not it gives, it allows home providers, to qualify for that. But I mean, I'm happy to look it up and kind of look into it with you. If you want to email me or whatever, I can do that, because we've been helping our staff to see what, who can qualify and that kind of stuff. And so yeah, so yeah, I'm happy to help kind of navigate and look that up for you. But I know that you have to either be if you're not tax exempt, you have to have provide certain what they consider qualifying services. And then also you can also work for state agencies. And it's not just education. It's if you were in public service. And so, but yeah, Emily, if you want to email me, you know, I'd be happy to look into that. So let's get.
Yeah, thank you. I think it would also be life-changing for a family provider that
Well, this is Amy Gottchammer, and I've asked about this too over the years at national conferences and things, and I've always been told you have to be 501c3, and it really is difficult not only for FCCs, but I'm a small business owner too of a center, but you know everybody knows early childhood, you know, whether you're for profit, it's a misnomer, you know. we're not making money, and we could all benefit from those loan forgiveness, but that's a conversation for another day.
Yeah, and it says nonprofit or public service provider. And so I don't know whether or not with the expansions, they widened that or not, kind of expanded eligibility or not, I don't know. And so, but definitely more advocacy efforts on a federal level are needed because they might be canceling some people out that really should be eligible. So, but for those who meet the criteria, again, you have until October 31st to submit your application. Not for everything to be done, but just to submit the application. Okay, any other bright spots that we missed? So our next meeting is our upcoming meetings. We have our Kansas Children's Cabinet and Trust Fund meeting on Friday, October 7th. We have our early childhood group meeting on Friday, October 7th, and that's going to be following the Children's Cabinet and meeting. And then our next panel meeting is Friday, October 21st. And so I thank you guys for coming. Those of you that gave presentations, I love being able to get updates on things that, like, you know, we were there like in the beginning conversations of things were happening, to see things actually coming to fruition, to see that the things that we hear about are not just like fun conversations, but then it just sits on somebody's shelf and nothing happens with it. And so it's nice to see all of this movement happening with things that we've discussed and or recommended with the panel. And so thank you guys again for your time. And I look forward to seeing everybody next month. You guys